believe in anything I say. No, don't go believing me. No, don't listen to me. Don't take any notice. Don't listen to anything that I say. Thank you.
Good afternoon and welcome back to Downing Street for today's coronavirus briefing. And I'm joined by the Deputy Chief Medical Officer, Professor Jonathan Van Tam.
Where the future is being made today.
And by NHS England's Medical Director for Primary Care, Dr. Nikki Kanani.
Nick knocky nick knock nicky knocky nick knack nick knocky nick knock nicky knocky noo nick knocky nick knock nicky knocky nick knack nick knocky nick knock nicky knocky noo.
There are still 29,326 patients with COVID in hospitals across the UK.
Zoom in there. You can see the 7-day average peak is on the 1st of January, but the actual peak was 29th of December. The dotted line there obscures the diagram a bit. You can see there, that's the 29th of December peak of cases. After that, cases were falling.
And sadly, 841 deaths have been reported on average each day over the past week. The first is our next steps on the vaccination programme. It's now 2 months to the day since Margaret Keenan got her first jab.
But they can only poke the hornet's nest so long before they get stung. Who are these people?
The first person in the world to be vaccinated with a clinically authorised vaccine for coronavirus. We have now, as of today, vaccinated more than 12.2 million people. That's almost 1 in 4 of all adults across the United Kingdom. Take-up of the vaccine so far has been significantly better than we hoped for. Based on the work we'd done before the vaccination programme started, and looking at the surveys, we knew that the UK had one of the most positive attitudes to vaccine uptake. But even so, we thought we'd get take-up of around 75%. I'm really pleased to be able to tell you that, as of midnight last night, among the over 80s, we've now given a first dose to 91%. Among those aged between 75 and 79, it's 95%. And almost 3/4 of those aged between 70 and 74, who were the most recent group to be invited. That's almost 1 in 4 of all adults across the United Kingdom. We've also visited every eligible care home with older residents and offered vaccinations to all their residents and staff. So among eligible care home residents, the take-up is 93%. But we'll not rest until we vaccinate all those in the most at-risk groups, because vaccines save lives.
The VAERS, the VAERS reporting system. The patient had the second jab at approximately 2 p.m. on Tuesday, January 12th. He works at the extended care. Now, this is someone who just works there. Look at that. Reads here, he was in good health that morning with no complaints. He waited 10 to 15 minutes at the jab admin site, then told them he felt fine and was ready to get back to work. He then was found unresponsive at 3 p.m. within an hour of the second jab.
They protect you, and there's increasing evidence that they protect all those around you as well. The fewer people who are left unvaccinated, the safer we'll all be. And the more securely we'll be able to release restrictions when the time is right. I've been thrilled to see so much enthusiasm about coming forward for a jab, and I'm just so pleased that take-up has been so high. But we're not going to rest until all those who are vulnerable have been protected. So the NHS and local authorities and the teams working with them are doing everything they can to reach the remaining people in these at-risk groups. And we'll keep on searching for those final few percent, even as we expand the offer of a vaccine to younger age groups.
Right now, it's the only way we can control them.
And I'm going to ask Dr. Kanani to say a few words more about this project in a moment.
Because things are changing, and not for the better.
Thanks very much indeed. That ends the Coronavirus Daily Briefing for today. Thank you.